about, but I am the integrative oncologist here at Ironwood, and I'm here to kind of talk to you about how integrative oncology may kind of optimize kind of the cancer care experience. And just a little bit about my background. I joined Ironwood in May of 2018 to be able to offer these services to Ironwood patients, but I've been a physician in the Valley for over 20 years. I started out as a family doc, and it really was my experience taking care of my mother who had terminal colon cancer. As a young doc at that time, my mom was kind of looking for ways to integrate some of her natural therapies with her conventional cancer treatment. And I was a very kind of conventionally trained doc at that time, and I really didn't have the education, and there really weren't, this was kind of over 15 years ago, and there really weren't kind of those services available in the community. So either at that time you could pick to do kind of alternative cancer care, or you could go the conventional route, and there wasn't really anybody to talk how to kind of merge those fields together. And so that, after my mom passed, that really kind of inspired me to kind of train myself in ways to kind of bring these two worlds together. So I went on and I did a fellowship in integrative medicine through the University of Arizona's integrative medicine program, which is kind of where Dr. Weil kind of has led that program, and trained afterwards in acupuncture and functional medicine. And then I kind of worked with the University of Arizona to kind of create their first integrative health center in downtown Phoenix. And we brought together their physicians and chiropractors and nutritionists and health coaches and acupuncturists, counselors that all work together kind of in more of a team-based model to deliver patient care. So kind of after we end up having to kind of close that center due to some funding issues with the University of Arizona, I'm now here offering those services to here at Ironwood. How many of you are familiar with this whole field of integrative oncology? Is that something that you've kind of been exposed to a little bit? So a few of you kind of have some understanding of what it is. Well, let me just see if I can get this thing to move forward if it wants to cooperate. It did earlier. Okay. So, integrative oncology, as I said, over 15 years ago, there really wasn't much. So it's really one of these emerging fields that have come in the cancer care arena that looks to kind of combine, this kind of complementary therapies with, your conventional cancer treatment to support patients kind of throughout their cancer treatment, to help them with side effects, emotional, physical well-being, and also look at kind of optimizing that healing response. But I will say where, your conventional oncologist is very focused on taking care of the cancer appropriately. In integrative oncology, we kind of step back and we look at that person that has cancer, and that kind of from a more holistic view, mind, body, spirit, lifestyle, to understand kind of all the different elements that are at play for cancer. And so that's kind of really where I think integrative oncology, plays that greatest role in helping educate, empower, and inspire patients to really take an active role in their health care. And so I work with patients in kind of all phases of their cancer care. Sorry if this is not. But who is it that's going to benefit? And I have some patients that are 5 years out from treatment, and they're saying, "Is there any benefit for me being getting integrative oncology service?" Well, absolutely. We take care of patients anywhere along their continuum of cancer care. So at diagnosis, we see a lot of patients who are about to launch in to chemotherapy, radiation, surgery, and we work with them on ways for them to kind of optimize their experience with chemotherapy, helping decrease some of the side effects of those medications, helping protect some of their organ systems from the toxicity of these drugs, working on helping kind of recovery from radiation, and helping gear patients up for surgery. How do we kind of tune the body up so it's in the best place to be able to handle the insult of surgery and help with kind of tissue healing, wound healing with surgery. So those are kind of patients who are kind of there in the beginning of diagnosis, and then a lot of patients come to us while they're in the middle of their treatment because they're having all kinds of complications and they're not sure that they can continue on with the recommended treatment plan. They feel too sick from it, whether it be digestive disturbances, severe neuropathy, fatigue, what have you. A lot of our breast cancer patients are on aromatase inhibitors, some of these meds that give them severe hot flashes and joint pain, that if they're able to take these medications, they can significantly improve their survival, but sometimes the quality of life becomes, such an issue that, there's a question of whether or not you want to continue on these things. So we look to see, are there different ways that we can incorporate some of these complementary therapies to help them, and be able to complete these therapies that are recommended for them. And so many of our patients, I would say a majority of patients who are diagnosed with cancer are on some type of supplementation. And how do you incorporate those supplements safely with the cancer treatment plan? They're going on some of these chemotherapy drugs. How you metabolize some of these chemotherapy agents can be significantly impacted by some of the supplements that we take, and how whether or not these supplements are going to make our therapies less effective or more toxic can be a real concern. And so generally most oncologists aren't prepared to have an educated discussion about how these different supplements kind of really combine with these drugs. And so that's really where kind of having an integrative oncology consultation can help, so that we can figure out what ones are safe to continue. Are there other ones that may be beneficial to add in, so again, to help mitigate some of the side effects and improve kind of your experience during cancer treatment. So it can be a very valuable consultation to have. And then so many times when our patients are completed with their treatment, they tell me, they feel wrecked. They're tired. They feel like their life has been destroyed by their cancer treatment, and they're really struggling to kind of get back to living. And so, those are areas that we really kind of dig in and find ways to kind of help them. Things like sexual dysfunction, things like neuropathy, digestive problems. These are all things that some of the kind of the harsh drugs of chemotherapy and things can cause some significant problems with. And how do you recover from that? So we look at kind of trying to assist the body's healing response, utilizing such therapies as acupuncture, some of this nutritional supplementation, mind-body type of things to work on de-stressing and working on physical activity, because certainly that can help bring up energy levels. So all of those things can be benefited by just kind of, again, incorporating some of these complementary therapies. And then, cancer survivorship, that's an area that, I'm very passionate about, in patients taking an active role and, really kind of changing the trajectory of their health, that, you can have a significant impact on cancer recurrence rates. That's every, cancer survivor's concern is this cancer going to come back, right? And so what can you do, as a patient to, change that rate of recurrence? And so there's many things that we work on that can significantly impact whether or not that cancer is going to come back. So what do we do in a consultation? Well, I have the luxury of spending 60 to 90 minutes with my patients in their consult. So, that really gets me to know the person, as from that more holistic view. My main goal is to understand what the goals of the individual are. Integrative medicine is really all about collaborative decision making, really kind of partnering with patients. I'm not here to tell you what to do, but I'm here to to educate my patients so that they can make informed decisions as to where they want to go with their care. And so really kind of understanding the goals is what's going to drive our discussion over the next 60 to 90 minutes. We really kind of dig into that lifestyle piece, because as we'll talk about a little bit here coming up, lifestyle is really that foundation. So I need to understand where you are nutritionally. What are your stressors in your life? Who's your support system? Are you physically active? Are you sleeping okay? These are all important pieces of how you're going to do with your cancer. So we need to kind of understand where you're at so that we can effectively kind of make some recommendations to help you move that mark. And then obviously we want to look into your medical history, because obviously there's other components of your health that are playing a role in cancer. Most patients have some other, condition that may be also contributing, diabetes, heart disease, kidney disease. All of these things play a role, and we have to support all these systems to kind of move health. So, we need to understand, again, that whole view. I have my patients bring in their shopping bags of their bottles of their supplements, because we do, whether it's 2 or whether it's 40, and we have patients taking, anywhere in between that. But I need to understand what you're taking from a supplement and looking at the bottles, understanding the brands, understanding what's in it, so that we can make, give you some kind of truly educated information as to, whether or not that's something that you want to continue. Are there other options for you? So we can kind of give you a very solid kind of supplement recommendation plan. And then, we come up with lots of different recommendations, and so we really kind of create, your own kind of care plan so that you have something to reflect on, because so many times we've talked about so many things. They go out and say, am I expected to remember all of that? No, we write that down for you so that you can refer back to it, and that we can kind of keep, going over that visit after visit. Generally, after that first visit, we do a follow-up visit. Sometimes we'll do some, diagnostic testing to understand. I really like to understand how you're doing from an inflammatory standpoint in your body, what your blood sugar control looks like. All of these are drivers in how your body is going to deal with these cancer cells and how your immune system is going to function. So we may look at some of these labs to understand kind of what role they may be playing in kind of your overall health. So anyway, that's kind of what we do in our consultations. But this slide is the slide that drives me in what I do every day. Here we have Pharmaceutical Research Journal telling us that cancer is a preventable disease that requires major lifestyle changes. The Pharmacy Journal is not telling us that we're waiting for the next blockbuster drug to change your cancer. They're telling you you have to change your lifestyle in order to make a change in your cancer, right? So, what we know is that only 5 to 10% of cancers are related to a genetic defect. That means 90 to 95% of cancers have a lifestyle or environmental component to them, right? So it only makes sense that if we're going to change the trajectory of cancer, we have to work on lifestyle. It's not fancy, it's not anything, it's back to the basics, but these are the things that move health. So this is where patients have to take ownership, right, of their care. There's nothing people can do to you. It's something that you can do for yourself, right? A lot of these components of lifestyle are within your control. And so those are the things that we really kind of dive into with our patients so we can change the trajectory of their health. I always, talk about lifestyle being kind of the foundation of everything, that I do. If we don't have a strong foundation, I don't care. I said you can't supplement away, a poor lifestyle, right? So I can't, say, oh, take these 10 supplements because, you're not eating well and you're not exercising and you're not, we really have to work on the foundation first, and some of these other things can be additive to move the mark on cancer. So working on that foundation is really kind of what my job is. Nutrition is really one of those key pillars of foundation. And we know that a majority of Americans' diet looks like that one on the right, where the one on the depends on your left. You know what I'm talking about. But it's the one on the right that really is the diet that's going to promote health and prevent cancer and reduce cancer recurrence. So, how do we work, on that piece? We know that food is, and diets are a huge driver in cancer. Estimated 35% of all cancers have a dietary component to their cause. So if you don't work on diet, you're missing over a third of the opportunities to change the trajectory with cancer. Right, so we know it's a huge risk factor in many diseases, whether you're talking about heart disease, Alzheimer's disease, diabetes. I mean, all of these chronic illnesses, which cancer falls into, have a dietary component. So, again, diet becomes a very important issue. We know that, what a majority of Americans are eating in our kind of fast food world, is a very nutrient poor diet. You're getting very few, vitamins, minerals, essential fats, all of these things that promote health. Too much sugar, too much saturated fat, trans fats, all of these things that promote disease. So, we have, one of the studies that looked at stage 3 cancer patients, all of different types of cancers, but what they found was that those stage 3 cancer patients that were eating the worst standard diet had a 3-fold increase or a risk of dying than compared to somebody who ate a kind of more of a healthy diet. So, these are stage 3 cancer patients. Food is making a difference in their survival, right? So we know that food makes a difference kind of no matter where you are in terms of your staging of cancer. So we definitely want to, understand what you're eating because, food affects our biology. So, again, I have so many patients asking me, what's the best diet to eat? How should I eat? There's so much confusion about food. And I always say, food should be simple. Really we want to eat food that has gone through minimal steps of processing from farm to table. Whole food, I don't think there's a lot of kind of whole foods out there are bad. Some people do better gluten-free or dairy-free, but I think it's really, it's all about kind of balance and moderation. And a majority of people should be eating the spectrum of foods where they're getting lots of fruits and vegetables. So many studies on how fruits and vegetables affect health and cancer survival. The more fruits and veggies you eat, kind of generally the better your survival. So, it's really important that we focus on these as being, impactful in, how our health really kind of evolves. So, lots of veggies, high fiber, so generally even adding fiber supplementation, when you eat kind of whole grains, you get more fibers in there. There's this whole concept of good fat, bad fat. Bad fats are going to be these trans fats, hydrogenated oils. And so we really just focus on people eating, extra virgin olive oil, nuts, seeds, avocados, fatty fish. These type of oils decrease inflammation in the body. If you eat a lot of saturated fat, so animal-based fats, butter, cheese, these type of things, they create inflammation in your body. And inflammation is what we understand as being a foundation for a lot of different chronic diseases, cancer included. So sugar is another one of those toxins that we eat way too much of and we get addicted to, and it's hard to kind of step away. But sugar creates a whole kind of shift in our biology that creates inflammation and drives up our insulin. And there's whole links between, when our insulin levels goes up, it kind of feeds cancer cell formation and cancer cell replication. So we want to keep insulin levels low, and to do that, we can't eat a lot of sugar. So, that's a hard one to give up, but it is, I always say, it's all about budgets, and sugar should be a really small budget, right? So it's not necessarily a no, but, and then, one of the stars of, kind of these superfoods, I would say green tea, has some of these chemical compounds in that, fight cancer. And so I always try to get my patients to drink about 3 cups of, organic decaffeinated green tea a day. And we really like, the cruciferous vegetable family. They're in that superfood family. So broccoli, cauliflower, Brussels sprouts. These things have some chemical compounds, something we call sulforaphane, that really kind of decrease cancer cell formation. So we really like to incorporate some of these superfoods, in your diet. But just eating a diet, that's colorful, lots of different colorful fruits and vegetables are really where you kind of want to focus what your diet should look like, and not that kind of bland white kind of diet that we saw on the screen. the other, huge driver in terms of, cancer is, some of these habits that we have, smoking, and, incredibly toxic and, hard to give up. And so I have some patients, coming in and they're still actively smoking as cancer patients, and, they want to know what supplements they should take and what, how they should eat, but, I think, we really have to start with the foundation is, you have to stop smoking to make a big difference. And so, there's so many different ways now to get support with that. All the studies showing that using some of the nicotine replacement products really can help patients. There's different meds that decrease, your drive to smoke. So really kind of getting the assistance you need to quit is incredibly important. And then alcohol is always a big topic in our consultations. It's one that I think a lot of people have in their regular day-to-day social life. And we hear lots of things about alcohol, how it's good for your heart and all of these things. But unfortunately, when it comes to cancer, any amount of alcohol consumption will slightly increase your risk of cancer recurrence. So it becomes a balance. It's a small increase. The more you drink, the higher your risk of recurrence is. So, for some people, alcohol is incredibly important in their day-to-day social life, going out with friends and not feeling excluded from those events. So, we really have that discussion, but I really try to see if we can get a patient to limit their alcohol to at least, 3 servings or less of alcohol, a week, to be able to really kind of, walk that balance between having a normal life, socially, and not significantly raising that risk of cancer recurrence. And then there's also other environmental toxins out there where we, talk with patients about. One of my favorite resources is Environmental Working Group. They have a website, ewg.org, but they're a consumer advocacy group that, educates, the consumer about what products have harmful chemicals in, and what are we putting on our body, what are we cleaning with, what are we cooking with. They're the ones who come up with their Dirty Dozen, the Clean 10, in terms of which fruits and vegetables have the highest amount of pesticides in their farming. Those are the ones that you want to, preferentially spend your money on buying organic. But there again, it's a great resource to become educated on, so that you understand what kind of your body is being exposed to, so you can make a decision. It's not possible to live in a perfectly clean world, but I always talk about just lowering the toxic burden, right? So just again, not cooking in plastics, not drinking out of a lot of plastic bottles on a regular basis. Again, occasional exposures, not a big deal, but if that's kind of where you're, getting your water from all the time, you got to be careful. Or what, heating foods up in plastic. A lot of these plastics, can have some carcinogenic effects in our body. So just kind of looking at all of those different, exposures in our life, and just trying to kind of take that burden down a little bit, so that our DNA isn't being bombarded with so many toxins that can kind of affect our immune function and increase DNA mutations that can lead to cancer. We know that movement, is really kind of one of those things that you can kind of take control over in terms of, having a significant impact on, cancer recurrence, as well as every chronic disease I can name. If you move, you lower your risk of it, you lower your risk of dying, and cancer, is the same. If you get exercising, you can improve your survival. What we know is that, exercise is probably one of the lifestyle areas that we can have the biggest impact on cancer recurrence. Colon and breast, they show that it had the strongest effect, up to a 60% reduction in recurrence from getting some significant exercise. Patients say, well, how much should I exercise? Well, what they found was kind of the sweet spot was about 3 hours a week, which kind of equates to about 30 minutes a day. So for most people, 30 minutes, out of your 24-hour day is manageable if you dedicate the time and put it as a priority. But we know that, those patients who, when we looked at the breast cancer population, those who increased their activity after diagnosis of cancer had a 45% lower risk of dying than those who kind of didn't make any change in their exercise or activity level. So, and if we add food plus exercise together, we can have even a stronger impact on survival. So again, these are how these lifestyle things can make a difference in our health. Weight is another issue where we find that body fat makes a difference in cancer development and cancer survivorship. And so 1/5 of all cancers are related to overweight and being obese. And so, we know that women who are overweight, their risk of dying from cancer is significantly higher than those women who aren't overweight. So 20% of cancers in the postmenopausal women are related to being overweight or obese. So again, very important that we work on kind of getting our body fat down, working on kind of movement and nutrition as a ways to impact the trajectory of cancer. The other area where I really focus on is sleep. Sleep is that time to restore, and we do see a link between poor sleep, inadequate sleep, and cancer risk. So really kind of focusing on creating good routines to kind of get you to sleep is an important piece of overall wellness. So less than 6 hours a night, increased risk of breast cancer by over 60%. So anyway, these are kind of significant numbers. And then obviously stress is those one of those other toxins in our life, and so it's an area where I say a lot of patients say, oh, I want to try to remove myself from stress, or but I say that it's not possible for so many patients to stop their stressful job, get out of stressful relationships. So it's about creating resiliency is really the most important piece of it. Those are the things that we can control. We can sometimes not control our stressors, but we can control our response to stress. So as Americans, we're given very few tools to be able to manage stress in our life. Nobody as a little kid told you what to do when you were feeling stressed. Most of them say, it was kind of more suck it up and move on, and don't complain. But we didn't really kind of develop any tools when we're feeling stressed. How do we get rid of this stress? And so we tend to go to substances. We tend to kind of develop bad behaviors, or we let kind of stress kind of build up in our life and have more of a biochemical effect where it affects our health. So we really kind of work on tools. That's part of what we do, in our consultation, is helping patients identify ways to relieve stress in their life. We know stress can play a role because when we're stressed, our whole chemistry changes. Our cortisol levels rise, our blood sugars rise, our insulins rise. So stress is not just in the mind. Stress changes kind of our whole chemistry. And so it's really important to acknowledge it and to have ways to help kind of let stress go. So whether it be exercise, some people go out, have a vigorous run, they feel like stress is relieved. Meditation, not for everybody, but some people really feel that meditation can help them calm down, and there's lots of studies about how meditation improves health. Some studies looking at how people who are regular meditators have thicker cerebral cortexes. We think that that's kind of related to meditation lowers stress, lowers cortisol. Cortisol then doesn't have that effect of kind of causing atrophy in the brain. So stress becomes something really that we need to be aware of, and that we need to kind of every day kind of be checking in with ourselves and how are we managing that, right? What are our tools? And can we find something other than a substance to help us calm down when we're feeling anxious, worried? What can we do? So, finding tools become really important. Another thing I talk a lot about is, our thoughts change our biology. So if we're worried and stressed, we create an immune system that doesn't function well. This worry suppresses kind of our immune cells, our ability to for our immune system to kind of find these abnormal cancer cells and get rid of them. When we have happiness and joy in our life, our immune system, it gets geared up, has a very kind of positive kind of impact on it, and we see significant, changes in how our body is able to deal with, different infections and cancer cells. So we can make, those active changes in whether or not we want to live in that worried and stressed world, or do we want to focus our day on finding joy, happiness, reason for gratitude, and smiling. So, again, those are just some things that, as a patient, you can kind of take control of and, look at some of those resources. Here, at Ironwood, we have, a whole host of integrative services that we've kind of put together to offer our patients. Besides my consultations, we have, 2 nutritionists on staff. We have counseling, social work for patients who are, dealing with, stressful situations, which cancer commonly brings up, to help them kind of navigate some of the difficulties that cancer has caused in their life. We offer massage services at both the Scottsdale location and the Chandler location. We just started offering in-house acupuncture in Chandler. In Scottsdale, we utilize the same group of acupuncturists. They have an office just a few miles from us here in Scottsdale, and they see patients at a reduced fee, our Ironwood patients at a reduced fee. So our patients have access to acupuncture that way. And then we are constantly, rolling out different classes for our patients, but a lot of them focused around this concept of stress, right? Yoga, meditation, drumming, and then we offer, a different array of different nutrition classes which we're rolling out. As Kelly told you, in February we're launching our survivorship series, which is our 4-part series to really kind of, dig into some of these lifestyle elements that are so important in survivorship. And then we have a large number of support groups, and we know kind of that social support, during cancer can make a huge difference. Not just from kind of the kind of social aspects, or sometimes even just learning strategies how to deal with some of the different challenges that having cancer, brings up in one's life. So I strongly encourage, anybody to seek out, one of our support groups, because it can be incredibly, valuable tools in your cancer care.